Is it a nice thing to do to throw certain bodily fluids at somebody? Not necessarily. Well, no, we can say no. I think we can all agree. No.
I was going to go with your first answer, not necessarily.
Not necessarily.
Not necessarily.
But some people.
Some people.
Okay.
I'm going back to the movie The Help when she made a pie. Some people.
Yeah. Well, let's just say not
necessarily. We've agreed there.
But there is that is actually a misdemeanor.
Yeah.
Okay. So prosecute that.
Yeah.
You know what I mean?
Mm-hmm.
Why make it something a felony when there's absolutely no risk?
Yeah.
It's just stigmatizing to that person when there's absolutely no risk of transmitting HIV that way.
Welcome back.
Welcome back, everyone. I am Ahmea Pacheco Branch. I was going to say, I can never get this down packed when we start. I'm Ahmea Pacheco Branch.
And I'm Javontae Lee Williams.
And we have today Dr. Kathleen Brady with the Division of HIV Health.
Kathleen A. Brady. There is another Kathleen Brady in the world, so we want to make that distinction.
We're going to make sure that we know that we are with Dr. Kathleen A. Brady with the Division of HIV Health. How are you today?
I'm really good, and I'm so happy to be here with
I'm
you guys.
excited that you are in the building with us today.
She's also our boss.
Well, she's your boss. She's my boss's boss.
This is true. Facts. So we're actually here with Dr. Brady because you are, I would say, one of the country's experts. Well, in the grand scheme of things, and you're going to probably say, nah, but you are a country expert on HIV criminalization. And so, Ahmea, we're recording this the day before,
Of course,
National HIV is Not a Crime Day. So what is that day?
So that day is to, you know what? I'm not going to take over that. Dr. Brady, can you tell us about HIV is Not a Crime Day?
Yeah, it's really to bring attention to the fact that HIV criminalization is something that occurs across the United States and the world, and that we need to make sure that folks are aware that this happens, and that it hopefully in the future will be something of the past. And so we want to make sure that everyone is aware that this is happening.
So before we dive into the HIV is Not a Crime Day and talk about decriminalization, I like always to know where people kind of got their start.
You literally took the question out of my head.
Were you?
I literally was like, is that on my list of questions? If not, let's start.
Because we said that you are our boss, but how did you get into HIV work?
Oh, wow. So that's a really great question. So when I was in medical school in Boston, I saw a lot of HIV, and it was especially at Boston City Hospital, which is one of the hospitals that I trained at. And, it was something I was interested in. And then I came to Philadelphia to do my residency at Temple University Hospital. It was really at the height of the HIV epidemic in 1992 when I started. And I mean, at that point as an intern and resident, I had to tell people that they had HIV. I was diagnosing it. And, I was essentially telling people that they had a death sentence. And, it was one of those things where a lot of it had to do with the people. And, as a budding, what I thought was going to be a primary care physician, I took on taking on the primary care of people living with HIV. And, I remember losing one of my patients. And that really had a profound impact on me. And I really started looking into, developing treatments and things like that. And, it's one of those things where I never had found a group of people who were so really grateful for the care that we gave to them, especially, marginalized populations. And that was it. I was hooked.
Yeah, you drank the juice, so to speak. Like you were all in public health and HIV. And so from 1992 till now what do you do?
Now, what I do is a little bit different than direct patient care. I certainly spent the majority of my life as a physician treating people with HIV, and also while working in public health. And I realized that I could really, with my skills, that I could make a greater impact on the lives of people living with HIV in public health than basically on the individual level. You can only see so many patients.
Yeah.
And so I, I'd been since 1999, I was the medical epidemiologist. In 2002, became the medical director, and I was doing that. And then the pandemic hit, and I ended up becoming the director of the Division of HIV Health. And
It was like Game of Thrones at the health
It is.
department,
Yeah, it
where
was.
like it was this person over here and that person. The pandemic did a number on us.
it did. And so,
I'm excited about the pandemic, but I'll tell you why.
well, and so, it's not necessarily, I always say I'm not necessarily an ambitious person. So, I was offered the position, and I realized that, I did want to, I did want to do it. I have the skills, and, this happened around during the time that we began our process towards, developing our plan and implementing our plan and ending the HIV epidemic.
Our local plan to end
And
the
the
HIV
HIV
epidemic.
yes.
For those of you watching internationally, that's a federal program in the United States to focus on ending the HIV epidemic.
Yeah. So
And Philly's one of the city.
And that's why I came to
Yes.
So the Division of HIV
HIV
Health.
Yeah. So what I do now is, I'm really helping to, implement that plan, which
Yeah.
is really exciting work.
Yeah. And we're going to have you back on to talk about public health workers. We're going to have you back on to talk about EHE. So I do
You're
want
like
to
our third. You're going to be like our third co-host.
our rotating co-host.
Well,
But
there we go.
Absolutely.
the one thing you told me, I remember the text the day you were made acting director, and you were like, "Just tell me when I'm being crazy." I have not had to have that
Okay,
conversation
good.
yet.
That's-
And you've allowed us to do a lot of new innovative things. This podcast is one of them, right? And so I think it's important for people to know the people behind the show, so to speak, because there's a lot of moving components. And me and I sit in these chairs or couches and we chat, but there's a lot that goes on to make this happen. And so we appreciate you for your trust and allowing us to do this.
And now you get to see exactly what we're doing. And
Yes.
you said yes to.
It's really fun.
It is fun. It's a really great fun part of our job. So I think, like, Ahmea, I'm going to lean on you to lead this conversation about criminalization.
I literally have been working on these questions, and I wanted to make sure that they were really good questions. I will say, before we go any further, that I have been getting really great feedback off of just our first video that we posted. Someone back home in Harrisburg, Pennsylvania, told me that they not only sat down with their daughter to be able to talk about sexual health in a way that we sat on this couch and was able to break it down, but they also, her daughter, went and told her brother. Her brother then thought, I need to tell my kids, which were 4. So we touched so many people with just this Philly Keep On Loving podcast. So
Yeah.
I just want to say how excited I am about that.
Yeah, it's really cool.
Thank you. So I do have some questions for you. I'm going to jump around some. But the first question is, what does HIV criminalization actually mean?
Okay, so HIV criminalization means that there are laws and policies that criminalize HIV transmission, but also HIV exposure, and or add additional penalties for other things, or upcharges, basically, for any other crime.
So if someone was to be HIV positive and maybe they're getting their hair done or they may be getting their nails done and they get a cut or something like that, and they don't tell that stylist or that nail tech that they're HIV positive, is that something that could actually fall under HIV criminalization?
I mean, it could. I think most of the ways that HIV is criminalized is not through HIV specific criminalization statutes and laws. So, but basically, there's not a state or territory in this country where there isn't the possibility of HIV criminalization. And most of those actually end up through general statutes. So there are many states who have very HIV specific criminalization statutes, including Pennsylvania, and we can get to those in more detail. But there are also people who get prosecuted through general statutes. So an example would be that someone has consensual sex with someone and finds out afterwards that their partner, has HIV. It doesn't matter if the person who the would say negative person is on PrEP, or whether the person with HIV has an undetectable viral load. They could be prosecuted under general statutes, and most of the time that might end up being as a assault or sexual assault or things like that. When there's absolutely the science basically supports that there's absolutely no risk of transmission.
So I had also seen some information when I was looking for some questions to get more questions, because I wrote down questions that I thought that would be really good and that I didn't understand, which may not, which may help some other people understand. I seen that sex workers can also be charged. What is something that they can do, or how do we work on something like that? Like, how do we stop criminalization through this?
Yeah, so the sex workers in particular have very high rates of criminalization of HIV, across the country. And so, in some places, if you're a sex worker and you're carrying condoms, you can actually be charged. There's just like an assumption that you have HIV or a disease to prevent. And in Pennsylvania, actually, sex work while positive, is criminalized. Here in Philadelphia, we're lucky because that really, in general, does not happen.
Okay.
But
Go ahead.
okay.
No, I was going to ask a follow-up question.
So what can people do?
Right.
And so, if you're engaged in sex work and you're arrested, you really shouldn't tell anyone your HIV status. Your HIV status is your own.
Okay.
Okay, and you should not be, letting anyone from whether it's the police or prosecutors, etc., let them be aware of your HIV status.
Thank you for that, Javontae. Do you want to follow up?
Yeah, because I think a lot of people are sitting at home or riding the train or listening to this, right, and asking themselves, but HIV is bad, right? Like, people should tell me about their HIV status if I'm having sex. But what we know from very good science is that if someone has an undetectable viral load, if they're in care, there's essentially no risk of transmission from sex. And so why then, can you talk about why these laws still exist?
So they were, in many places, they were put in place as to be a deterrent for folks not disclosing their status. But there have been studies that have shown that in areas that have HIV-specific criminalization laws, there's actually decreased HIV testing as well as higher prevalence. And among surveys of people living with HIV in states or just really across the country, that there is no deterrence, to or changing in sexual behavior among people living with HIV based on these, criminalization statutes. And the people who are, typically prosecuted, they're for the most part they're predominantly women. They're also Black and Latinx individuals, and so they're the populations that are already disproportionately impacted by HIV. And so, we're punishing people twice with no benefit.
So these laws are just on the books as kind of a knee-jerk fear reaction.
Correct.
And they don't serve any purpose.
Except to, stigmatize people who have HIV or might be at risk for exposure to HIV.
Yeah.
That's heavy. That's really heavy.
Yeah.
It sucks.
It does. Which brings me to my next question.
And not in the way we like on Philly Keep on Loving podcast.
Absolutely. Absolutely. Philly Keep on Loving. I can't, I had to get my little Philly Keep on Loving in. How does HIV criminalization hurt public health work?
Because people, public health is the government. And, if people are afraid, that they're going to be prosecuted for HIV, they think that, as the government and public health, we're going to be sharing this information about folks, and that, they're not going to be willing to participate in public health programs as a result, including HIV testing, engagement in care, et cetera.
That's another heavy piece. What do we do to kind of steer that though? What can the Division of HIV Health do to steer that?
Yeah, so we've made a commitment to try and fight HIV criminalization, both in Philadelphia and in Pennsylvania. And so the things that we really can do at the public health level is educate the public, people living with HIV, but really also we can educate whether it's city council members at the local level or state legislators, senators, prosecutors across the state, and also, the police about, that HIV criminalization doesn't work, that it harms people. And also, there's really no science behind these laws. One of the other laws in Pennsylvania, actually there's really two now, but one of the original ones was about basically correctional officers, and that it's basically throwing or spitting any bodily fluid at a correctional officer ends up being, a felony. And so, but you can't spread HIV through any of those things. Yeah. There's no science. Is it a nice thing to do to throw certain bodily fluids at somebody? Not necessarily. Well, no. We can say no. I think we can all agree. No.
I was going to go with your first answer, not necessarily.
Not necessarily. But some people.
Okay.
I'm going back to the movie The Help when she made a pie. Some people.
Yeah. What was you saying? Not necessarily.
We've agreed there.
But there is that is actually a misdemeanor.
Yeah.
Okay. So prosecute that.
Yeah.
You know what I mean? Why make it something a felony when there's absolutely no risk?
Yeah.
It's just stigmatizing to that person when there's absolutely no risk of transmitting HIV that way.
That's the biggest word that we have been continuously coming up with every question, stigmatizing. What can we do as public health professionals to, even on and off the clock, help stop stigmatization? Is stigmatization a word? Because if it's not, it is.
You left out one of the syllables.
Which?
Stigmatization.
Stigmatization.
But I'm going to go with stigmatization. Go ahead.
You like stigmatization?
I like stigmatization.
Okay. Stigmatization.
Yeah, I'm going to have a hard time saying either of those words.
To stop the stigma.
Let's stop the stigma. No, I mean, I think we need to get the word out through medical providers and through media that if you have HIV and you have an undetectable viral load, there's essentially no risk.
Yeah.
There is no risk of transmitting HIV to your sexual partners. And so, I mean, that's a great motivator for people to, for their own individual health, but also to prevent HIV and end the HIV epidemic. And so I think, I think it's an empowering message for folks. And so I'm hoping that will decrease stigma, not only for the people living with HIV, but, people, the general population will have a different perspective about HIV, and there'll be less fear.
Thank you, Dr. Brady. Well, Ahmea, we've come to the end of another episode.
Did we? Can I
Yes.
ask my one last question? I have really one last question that would wrap it all up. Do I have it? I don't.
No.
Oh, wow.
What was the question, just so I know?
Okay. Yes. If someone wants to work to help end the decriminalization of HIV, what can they do?
Yeah.
They can work with the health department. We want to actually work with community members in getting the word out, creating, community advocates who will rally against laws in Pennsylvania and at the national, well, I shouldn't say at the state level, really, because it's a state level thing across the country, but rally to prevent passage of any of these laws and to help passage of laws that will decriminalize HIV in Pennsylvania and other states, so that we don't want people to be prosecuted through these HIV specific criminalization statutes or these general statutes. So we want to stop it all. And we don't want to share any public data that would help prosecute anyone. And so that's really, whether it's through ACT UP, any other community organization, individuals contacting us at the health department, and, we'll make sure that you can participate in this process.
Thank you so much. Well, Javontae,
Well, now we wrap up.
this brings us to the end of another.
I'm being given permission to wrap up another
Thank you.
episode of Keep On Loving. Remember, this podcast is sponsored by FeelItKeepOnLoving.com, your resource in Philadelphia for all things PrEP, PEP, condoms, and other sexual wellness products. Please, if you're in the Philadelphia area, visit us to learn more. And until next time, no matter how you're loving, keep on loving.
Keep on loving.
Keep on
Keep
loving.
on loving.
We're going to get it together.
Okay, one,
We're out.